In this lecture, we will discuss how the ECG leads are able to localize different regions of the heart and where those regions are located on the standard 12-lead ECG. I wanted to take a lecture to review what we've learned so that you are starting to connect everything. More specifically, I want you to keep in mind the leads on the EKG that correspond to specific regions of the heart. First, let's go over the limb and precordial leads. So again, remember our limb leads are here. So this would be the limb leads. We have AVR, 3, AVF, 2, 1, and AVL. Okay, so 6 limb leads. Remember, if you imagine this is our 12-lead EKG, this right here, this portion on the left would be our limb leads, okay, and then this over here would be our precordial leads, okay. And if you recall, our precordial leads, which are here, are V1 through V6, so V1, V2, V3, V4, V5, and V6. And then we have those special leads where we can have the right-sided precordial leads, V3R, V4R, V5R, and V6R. Remember we said this can give us an idea of what's going on the right side, if we have a right ventricular infarct. And then we have those special leads, the posterior leads, which are a continuation of leads V1 through V6, and they are from V7, V8, V9, and V10. And that gives us an idea if there's something in the posterior portion of the heart, okay, this posterior wall of the left ventricle, if there's something going on there, okay? Because remember, our normal standard leads are only giving us an idea of what's going on in the anterior portion, okay? So if there's something going on back there, then we can use these posterior leads to help us see that. Now let's take these leads and see how they line up with the EKG. We will start with the inferior leads, okay? In this table on the left, this upper left right here, will be your friend as we move forward. So the inferior leads are 2, 3, and AVF, okay? And I've tried to highlight them here to make it easy for you to see. So imagine this is our 12-lead EKG. The inferior leads are 2, 3, and AVF, all in yellow, okay? So where do we see that in our heart, all right? So inferior leads, meaning they're looking at the inferior portion of the heart, which is down here. So here you have them. 2, 3, and AVF are down at the bottom. Next, we have our septal leads, okay? And our septal leads, we usually consider V1 and V2, all right? So V1 and V2 here in this brown shade. Remember, they sit over the anterior portion of the heart. And if you look at them here, this would be V1 and V2 over the septal portion. So when we talk about a septal infarct, we're looking at things in V1 and V2. Then we can have an anterior infarct, okay? An anterior infarct often involves leads V3 and V4. Sometimes you can have involvement of V2 and V5, both sides of it, okay? But generally when we speak, we say the anterior leads tend to be V3 and V4, knowing that it could range and include those that border it as well, okay? So this would be V3 and V4, our precordial leads sitting over the anterior portion of our heart there. Next we have the left lateral leads, okay? And that would be leads 1, AVL, V5, and V6. So where are those leads? Okay, so we're including these V5 and V6 where our left lateral leads, the left side of the body, lateral portion of the heart, okay? And that would be V5 and V6 here in blue. We also said there's some limb leads that are involved. The limb leads involved were 1 and AVL, so 1 and AVL, okay? So if you imagine here's the lateral portion of the heart, here's V5, V6, 1 and AVL. Okay, if you have an infarct in AVL or ST elevations, you'll sometimes hear it called as a high lateral. Okay, the high aspect of the left ventricle is involved in only AVL, so we call that a high lateral. Okay, but when we talk about the lateral wall, think of all this: V5, V6, 1 and AVL. Then we have those special leads, okay, and that was the V3 R for right-sided, up until V6R. So all these, and those are the right lateral leads, not on the standard 12-lead EKG, so we're not going to see that over here in our image, although we tend to still get these, and I want you to be aware of them if we think there's something going on the right side. Remember, inferior infarcts are often come along and accompanied by these right ventricular infarcts, okay? So usually we will want to see if the right ventricle is also involved. All right, so we can use those right-sided leads. And then the posterior leads, those V7 through V10 back here, are the ones that can give us an idea of what's going on in the back. So we mentioned if we see ST depression in those anterior leads, so V1, V2, and even V3, if there's ST depression, we may consider a posterior infarct because we're seeing reciprocal changes. And in those cases, we'll order these posterior leads, okay, especially if we don't have the presence of right bundle branch block present, and to see if there's something going on back there. Okay, so hopefully this is starting to make sense. Really understanding which leads correspond to different areas of the heart will really help us as we move forward, especially when we start getting into infarcts and how to localize them and so forth. Okay, let's briefly review what we discussed before we end. So again, this was a review, a compilation of everything we've discussed in terms of leads, the right side of the posterior, the standard leads of the limb and precordial, right? We talked about the limb leads, and there were the 6 ones here on the left side of the standard EKG. That was 1, 2, 3, AVR. Notice that AVR wasn't involved in anything we discussed, okay? So AVR isn't really too helpful all the time. There are some cases where some people use that, but for our purposes, we won't get into that now. And then there's also AVL and AVF. So those are our standard limb leads. And then we have the precordial leads. V1 through V6 are the standard ones. Okay, we said V1 and V2 over the septal region, V3 and V4 over the anterior region. When we were talking about the inferior infarct down here, or that region, is 2-3 AVF, so that's here in yellow. Okay, when we talked about the left lateral portion of the heart, we said 1 in AVL of the limb leads, okay, over here, also here, and also included V5 and V6, which is over there. Okay, so you can see that color coded, and that's what I want you to be able to look at the EKG and know what aspects of the area represent what. Then we talked about those special leads, okay, not always ordered and not on our standard 12 lead EKG, but I want you to be aware of them. The right-sided leads, right, V3R all the way up to V6R, okay, the right lateral portion of the heart, giving us idea of what's going on in the right ventricle, okay, is that involved in an inferior infarct or so forth. Then we have V7 through V10, which represent the posterior leads. So those in the back of the heart, is there something going on back there? Again, not always ordered, but if we see and we're suspecting some posterior infarct, then we may order them as well. Well, that's the end of this lecture. We discussed how the ECG leads are able to localize different regions of the heart and where those regions are located on the standard 12 lead ECG. I hope you learned something.